Good morning, everyone, and thank you so much for joining us for Helathline 3. I'm Nate Fluharty. Well, today we're talking about the topic of low testosterone, and we're joined by Dr. Chris Stage. He's going to be answering your questions for the next half hour, and we want to encourage you to ask exactly what's on your mind. So, wherever you are, if you got any questions, make sure you give us a call. And you can also click on the Helathline 3 box halfway down on the right side of your screen if you log on to ktbs.com. You can also submit a question if you want to do that. And the number to call, we just want to get this out there, is 318-218-4569. And we're going to be taking your calls until 12:30 today. So let's dive right in. Dr. Stage, thank you so much for being here with us today.
Thanks for having me.
And we're talking about something right up your alley when it comes to, I don't think a lot of people know exactly what low testosterone is. It sounds pretty self-explanatory. But if you could, let's first give people an idea. Low T, low testosterone, the same thing? What is it?
Yeah, it definitely is. It's just a low testosterone level, which is the main male hormone in the body that controls things like energy and sex drive and muscle mass. It's gotten a lot of press and become much more common. You see all types of supplements and so forth touting to increase your testosterone. So a lot of people are trying to make a lot of money off of this, and it's become pretty glamorous, I'd say, these days. But it is something very important. A lot of people will suffer with this, sometimes at fairly young ages, and we don't always have a good reason why. But it can definitely, affect your life in many ways. For sure.
So you're saying that age, obviously, I assume that as we age as guys, something tends to drop in that. But you said this can actually affect some younger kids as well.
Right, and it does normally decrease with aging.
Okay.
To a degree, for sure. But there's a lot of other factors that can influence it. There's some things that are more rare that are genetic or hereditary syndromes and so forth that can affect the testicles, or the brain's signal to the testicles that affect it, but those are more rare. Other things, just like environmental factors like drug use or alcohol abuse, anabolic steroid use can affect your body, and sometimes in the younger population those can be causes. A lot of times it's just idiopathic, or meaning we just don't know why. For some reason earlier in life the testicles just start producing less testosterone, and you start to get the signs and symptoms of it with the low energy, low sex drive, sometimes depression and mood changes, poor sleep. So there's all kinds of
it really impacts your life.
Yeah, decreased muscle mass and strength.
Wow. Now, of course, we're just kind of getting things started here, talking about low testosterone, low T, and we actually have our first caller of this segment. I want to say hi to Herman. Herman, thanks a lot for calling in. What's your question for Dr. Stage?
Yes. What could you do for that? What could you take? Is it something you can take, or something like that for kind of build it up?
Yeah, obviously, good question there.
Right. I mean, what can you do aside from taking prescription medicines or shots or these different things? And I think mainly trying to exercise, be active, all the things you think about for a general healthy lifestyle, a lot of times can actually help boost it. Being more active. Of course, if your testosterone is low, it can cause you to be less active. And so it's kind of a vicious cycle of not wanting to do anything, and then, it's lower.
And, I think what Herman was kind of alluding to when it comes to changing it, is it as simple as lifting weights? Looking back as guys from middle school to high school, our bodies go through some changes. You want to build the muscle mass, and testosterone, I'm sure it's a big part in building these muscles, or just kind of growing into our male adulthood. Is that something that you can do when lifting weights, or is that just...
Yeah, lifting weights and general cardiovascular exercise are helpful, but you have to get a blood test, of course, to diagnose what your level is at. There's a lot of things over the counter and supplements and herbals and things like that he may be thinking of as well. They're not well regulated, not well studied. I think the vast majority are probably not very useful. Some people would disagree with that. They're not well regulated, so you don't really know you're getting consistent concentrations or getting what they say you're getting a lot of times. So
that's with those off-market
right
herbal supplements, things like that, that promise the big boost in energy, gonna make you a big, strong guy. But you said
or
oftentimes,
just blatantly going to boost your testosterone. So some of those may have some activity, and we don't really know enough about them. They could be dangerous, frankly. I mean, unless you get checked by a doctor, really get your level checked to see where you're actually at. You know, that's the best way to start.
Now, of course, the number to call right now is 318-219-4569, talking about low testosterone. Obviously an issue pretty much plaguing the men. It's not so much that we're hearing a lot of these cases for women. Obviously, testosterone not really found prevalently in the female body, so it's pretty much a male issue, right?
Right.
Okay.
Exactly.
All right, so get those calls
Can I
in
make an
right now.
appointment to see you about this?
What's that, Herman? You can please repeat that?
Can I make an appointment to see you at your office?
Oh yeah, definitely. Call regional urology, and we can set something up for sure.
Okay, well, that's what I'll do. I'll get make a phone call and set an appointment, and then come out to see you.
Yeah, sounds like a good idea,
Call
Herman.
later in the week. We're closed today due to the weather, of course, but.
Okay then. All right. I'll give you a call. Well,
Thanks a lot.
Yeah, thanks for your
Wednesday,
call.
Thursday, y'all open back up, and I'll make an appointment.
Okay.
Okay, thanks, Herman. We appreciate
And I
that
think
call.
yes, my course is good, and I'll see you when I get an appointment.
Okay. All right. Be careful.
Okay, thank you very much.
Sounds good. Now, we want to hear more calls. You know, obviously, something that we're hearing so much more in the headlines. You know, in Health Watch 3, we just ran something last week about that. Is this something, you know, you brought up the point that a lot of these medical companies are trying to take advantage of this. Is this something that is as prevalent as what it was 20, 30 years ago, or is this something we're seeing new numbers, more cases of?
Yeah, it's an interesting question because there are a lot more cases of it now, but probably the biggest reason is because it's being diagnosed more, and some people think it's being overdiagnosed a lot. And one reason it's difficult is because it's hard to pinpoint what is abnormal. Unfortunately, on the blood test, the ranges are very wide. For example, 300 to 800, more or less. And so sometimes somebody with a level in the low 300s, it may be difficult to say whether they're abnormal or not. If they obviously have these signs and they're feeling horrible and tired all the time, low sex drive, and quite likely they really should be at a higher level and they're suffering from it. But then again, there's been a lot of reports of, you know, providers out there treating this with people with levels in the 400s that just want to boost their muscle strength and lift more weight and not necessarily really having an issue or having the real symptoms, and probably maybe shouldn't be treated, you know.
So it all comes down to that number, and you figure that out on a blood test.
Right.
Okay. All right, pretty interesting stuff here, Doc. Low testosterone, as we were saying, something predominantly affects the guys out there. And we have Scotty on the line right now for a question for Dr. Stage. Scotty? I thought we had Scotty on the line. Scotty, can you hear us?
Yeah, okay. Yeah, I sure can.
Okay, what's your question for the doc, Scotty?
Yeah, I sure can. Well, what it was, I mean, he's kind of almost answered that, and you're answering a lot of them. You're asking good questions, but here's the thing. Okay, I'm a Vietnam veteran. You know, I'm over 65 now, and there's really nothing that you can really take like food or something. You know, we see that all the time as being a male on TV. So the best thing to do would be to come and see you. And really get a blood test or something, really, huh?
Yeah, really checking it in the blood test is the only way you're going to know for sure what's going on, you know. And sometimes the primary care physician will check that in patients when they do routine lab work, you know, for example. That can be done. And I mentioned, you know, it's best to have it done in the morning, or earlier in the morning is better, you know, to get a more accurate reading. And you can certainly, if you suspect you have some of these signs and symptoms, you can certainly, you know, call us and get in, and we can check this, you know, and go from there.
That's a good question, Scotty. And you know, Scotty brought up the point that He's a veteran. Is this
Okay.
something that you've seen in local veterans, or is this something, something that plagues them, or a specific group of men, or some,
Not so much a specific group, but it brings up a good point about gentlemen that are a bit older, over 60, over 65. It's been a bit controversial because there's been some studies that came out showing a potential increased risk of stroke or heart attack is one issue. The more the data is evolving and coming out, the more it shows we don't believe really that's the case. So, today we think more that it's probably beneficial from a cardiac standpoint, to have a normal testosterone instead of harmful.
Yeah.
There's still a little bit of concern there.
Okay.
Yeah.
Okay, Scotty, you have any more questions for the doc while we got you on the line?
I don't think there's a lot of
just that I'm very appreciative for what he's saying, and look, I need to get your number then, Doc.
I think just eating a fairly low-fat, high vegetable type, general heart healthy diet would probably be the best bet, but it may not have a large impact as far as he was asking about diet.
So eat your fruits and veggies, Scotty, and in the meantime, get in there to see Dr. Stage. And this is something you're taking. Are you taking patients right now for the guys that are calling in asking these questions? We want them to be able to get them the help they need. Are you guys taking patients right now, especially with low T?
Yeah, definitely.
Okay.
Definitely. We see a lot of that, and that falls under the category of the men's health, which is becoming more and more prominent in practice in general. And we're really trying to take a big role in that in the community.
One thing when it comes to men's health, and I personally learned this myself as a man, it's you got to kind of watch things as you get older. Everybody knows that. Certain aspects of our health too, and medicine now is so specialized that it's not just as simple as waving a big wand over, well, it's probably this, or it might be that. You really do. You have to take the time, and don't ignore your body's signals, because it could be something pretty severe.
Yeah, definitely. I think it's always best to make a preemptive strike, and check on things. Don't put things off until you really have a problem as well.
That is good advice. Hey, the number to call if you want to pick up the phone, give us a buzz at 318-219-4569. Real simple to do. Give us a call now. You can also go to ktbs.com, check out the health link there on our webpage, and you can submit some questions for the doc as well. Dr. Stage is joining us. Obviously, today we're talking about low testosterone, low T. You've probably seen the commercials on television. One thing we haven't really talked about is this dangerous when it comes to depleted levels? If somebody watching out there thinks they may have this, they do have that, it goes unchecked for years and years. Is low testosterone something that could ultimately be problematic for somebody's health?
Yeah, and especially over time as you age. One of the big things that we talk about a lot is osteoporosis, because it has a lot to do with bone strength.
Wow.
We talked about muscle mass and muscle strength and all these things, but it also has a lot to do with bone health. And so you get an increased risk of fractures, and injuries as you get older. So that's a definite plus when you talk about the risks and benefits of taking testosterone as you age. There's this question about heart health and strokes and heart attacks. And we really believe that most of the data is pointing to it being more healthy to have a normal testosterone range versus the opposite, even though some studies were contradictory, in this way.
Sure.
So you need to worry about bone health, just general well-being, depression, mood, happiness. Like I was talking about sleep. Obviously, if it's affecting your sleep negatively, then this can affect all areas of your life if you're not sleeping well.
And for a lot of guys, I'm sure it's tough to put a finger on it. You just don't feel like yourself one day. Maybe the next it's another symptom, and it's, I could only imagine for some of the guys that are dealing with this, that how can you pinpoint one specific thing, or do they look at it like, well, I'm experiencing several of the symptoms that you mentioned. It's time to get checked.
Yeah, and I think the biggest ones are energy, which of course there are other things in your life that can affect your energy level, and then some people will start thinking it's just because of this or that, or try to blame it on their job and so forth. But you have to stop and think, well, it may slowly occur, not just suddenly one day, and so you don't really realize it. And of course, you know, sexual function is another big one that is talked about a lot, of course, on TV and everything else. And sometimes your partner, of course, may notice this as well, like you mentioned earlier, your significant other.
And sometimes that's what it comes down to.
Yeah.
You know, we can ignore, as guys, we do. Yeah, I'm stubborn. I know a lot of other guys out there are stubborn too. We wait and wait and wait to go to the doctor until it's almost too late. But you know, for a lot of guys, you have to think too that this isn't just about you as well. You have a partner in this, and they can obviously be affected as well.
That's right. Absolutely right.
And Dr. Sage, we do have another caller on the line. I believe we have James on the line. James, you have a question for the doc?
Yeah. What kind of man do when you pass 80 years old for an erection?
Good question there.
Yeah, that's a good question, because there's definitely some correlation between erectile function. Low testosterone can certainly affect that. You really just, you know, you need to go in for an appointment to look at the different options, because of course one of the first line treatments there, of course, is pills, like you hear about, you may have tried before, prescription medications like Viagra, and besides that, there's some other somewhat more invasive types of treatments like shots and different types of devices that you would want to discuss more in the office in detail. But yeah.
Now, is you know, just to kind of bridge what James was talking about there, is low testosterone connected to erectile dysfunction, or do they go hand in hand like that?
To a degree, they do. Unfortunately, many times when we correct the testosterone problem, it doesn't completely correct the erectile problem. In many cases, it helps. See, the younger the patient, the better the chance of it helping, if that's an issue. But a lot of times some other therapy is also needed, even despite correcting the testosterone. So, you know, unfortunately with aging, erectile dysfunction is more prominent and correlated with age. So, you know, after 60, 70, it becomes almost universal that it's going to affect you to some degree. So.
And while we got James on the line, you know, what would you recommend for James? James, you said you were 80, a little bit more than 80?
Yeah.
Okay.
You should really come into the office and, you know, take a look at things and go over the options, I would say.
Okay. So, James, hopefully that advice helped a little bit. Get a appointment booked with the doc here and get you checked out.
It helps good. It helps real well.
All right, good deal. Hey, thank you, sir. We appreciate you calling in. If you want to give us a call, folks, it's real simple. 318-219-4569 is the number to call. You can also log on to ktbs.com and click on the side link there on our webpage. Talking about low testosterone this morning and low T. You've probably seen it. I see it a lot on commercials now. It's almost tough to turn on the TV, not see a commercial on low T one way or the other.
Right.
Do you feel like this is a problem that may continue to escalate when it comes to men in America?
Yeah.
I don't necessarily. I'm not sure if there's any reason to think it's going to just increase for any environmental reason or so forth, but we're so much more aware of it now. Like I was saying earlier, we're just diagnosing it a lot more because we're looking for it a lot more, and people are becoming aware of the signs and symptoms. You know, so I think we may have reached sort of a plateau of the percentage prevalence of it. You know, but I think it's going to continue
that
to
very
be.
much.
And I think the caller's still on the line.
Yeah.
So
Appreciate that very much.
No problem.
no
Thank you
problem.
for calling in, sir. We appreciate it.
Yes.
So yeah, hopefully we'll continue to find new and better ways of, you know, of treating it and more stable sort of delivery methods and so forth.
Okay. We'll get that phone picked up, 318-219-4569. The number again is 318-219-4569. If you have a question for Dr. Stage, give us a buzz right now. And Well, we still got the phone lines open. We'll have those open for another 10 minutes, and we are talking about low testosterone. Erectile dysfunction, we've heard about that brought up already this morning. For some of the gentlemen watching right now, if they may think that they're starting to head down that road of erectile dysfunction, when is it, obviously it's a subject that not a lot of guys feel comfortable talking about, but, obviously times are changing. What advice would you have for any of the guys out there, or girls for that matter, that may feel a little bit shy about bringing this to their doctor's attention?
Yeah, I think at this day and age, there's no reason you can't be comfortable talking about this, and I think people more and more are talking to their primary care about it, whereas they did in probably years ago. But it's just a normal, very prevalent health issue, and it really is something that should be addressed. There's no reason to be nervous or ashamed about it. Sometimes people feel more comfortable talking to a specialist, than their primary doctor, or they would prefer to be there alone and not with a family member. And so you have to take those things into consideration. So we're considered specialists, of course, in this area. So seeing a urologist is always a good option if you really just want to single in and focus, on these sexual issues.
Okay, now obviously low testosterone. It's an issue that's been around for some time. It seems like nowadays we're just getting a better understanding of the topic itself. So if you have any questions about low testosterone, give us a call right now. Log on to ktbs.com. Click on the side link there. Real simple to do. Dr. Stage, let's talk about you personally. Who were you with? Where do you set up practice?
Yeah, with Regional Urology, large single specialty group here in the Arklatex, and we have our main office and surgery center, of course, is all over off Burt Coons and 49, just off the interstate. I've been with the group a little over a decade now.
Nice.
We have about 15 doctors, so we have several satellites in Bossier, Minden, even Monroe now, Natchitoches, Vivian. So we're trying to spread out our footprint, so to speak, and really provide comprehensive care all around the region. I'm from North Louisiana. I trained down at UT Houston. Spent a lot of time training at some of the bigger hospitals in Houston, like
Wow.
MD Anderson Cancer Center, Herman Hospital. So it was a real good medical experience. But we decided to move back closer to home ultimately. And
Yeah.
so I've been glad to be in this area.
Well, it's great to have you back, and I'm sure you're helping out a lot of men. Now, do you see specifically just men, or I'm sure in?
No,
Okay.
I don't.
All right.
And of course, one of the big areas that we see is kidney stones, and that occurs in men and women.
The dreaded kidney stones.
Yeah,
Oh boy.
For sure.
All righty. Well, we have another caller on the line. A question for Dr. Stage. I believe Tim has given us a call. Tim, what's your question for the doc?
Hi. My question is, my doctor says through my blood test that testosterone is okay in a normal level, but I do have those tired symptoms, and I'm 64, or many of those symptoms probably lost muscle mass, and so I was wondering, is that he indicated that he not to take testosterone supplements because there's more harms that he's in internal medicine as well, that there's more side effects and harms that it causes. Wanted to get your thoughts about that, and also my blood test was taken in the afternoon. What kind of effect did that have?
I think you should definitely have it rechecked. It's really recommended to have it checked on 2 separate occasions, and actually a lot of insurances won't even pay for treatment if you haven't verified on 2 different levels, because it does vary from day to day and it bounces up and down a lot. That's one of the things that makes it difficult as well, talking about overdiagnosing it and so forth.
Mm-hmm.
So I think checking it in the morning is you should do that, and have another level done at some point in the morning.
What are your thoughts about him saying, and he's a good doctor, and he's been in practice for a number of years. He said that there's too many side effects, negative side effects.
Of testosterone treatment or over-the-counter supplements?
Well, of taking testosterone, I didn't get into how, was it hormone or treatments, or, I didn't get into those details. He just said that there's too many negative side effects. Kind of ended there, the conversation. He was against it, based on that my lab results were normal.
And I'm not sure what range they're calling normal, but I think you really have to look at it, because I think really that the benefits outweigh the risks for a lot of people, and so I would want to get it rechecked and see if it's borderline and you're definitely having these symptoms, then it could very well be beneficial, for you to take it. Like I was talking about earlier, these issues with heart, cardiac factors, and stroke and so forth, we really think the data is showing that it's really not a risk as once thought.
You mentioned that if you are taking it, then you have to go in routinely to get your blood monitor, I think, for liver and probably those other ones as well.
It's not as much of a. You have to monitor your blood levels, such as the thickness of your blood, for example, because testosterone naturally makes your body produce red blood cells, so it can actually increase that and make your blood, the opposite of anemia, make your blood sort of overly thick, if you will. And sometimes you just have to do something simple like donate blood periodically to keep it at the right level.
Which could be a good thing for everybody.
It's a healthy, normal function of testosterone in the body, and that's why sometimes low T can cause anemia potentially as well. Another thing we didn't mention earlier. But those are simple tests. You do routinely go in at least every 6 months usually, and check your lab work depending on what kind of treatment you're getting. But
am I hearing you say that in your opinion, if you have a normal level, you don't feel there are side effects?
No, if you have a normal level, then you really probably don't need you don't need to be treated. Just need to look at other things, talk to your primary doc, and see if there's other factors you can find that could be contributing to the fatigue and so forth. Other types of lab tests, or just general issues with your lifestyle and things like that. But if it's truly normal, then I would just leave that alone and look for another cause.
All right, thank you.
Thanks.
No problem, guys. We have about a couple more minutes here, maybe 2 more minutes. So pick up the phone, 318-219-4569, if you got one final question as we wrap things up with Dr. Chris Stage. And, Doc, before we kind of put the wraps on things, if anybody out there has some questions once time expires, once we run out of time, how can they go about getting some more information when it comes to low T or many of the other issues that you tackle?
Well, our website, which has been recently updated and is a good resource, regionalurology.com. That's a good example. And that's a good place to start. We have some other references, basically, as far as low testosterone.
And, as far as male medicine, what do you feel like when you put low T on the scale, what do you feel like is right now one of the more pressing things that you see that you would like to tell some of our male viewers out there? Maybe something as simple as getting to the doctor, getting some checkups, not waiting to the last minute, anything like that?
Yeah, I think definitely, especially if you're, under 50 and you're having a lot of issues with erectile dysfunction or decreased sex drive that have come on within a year's time or so, then it's a good idea to go ahead and get it checked, to see what's going on.
And what, based off of that, what is normal? I think it's for some guys out there, once having a problem in the bedroom, maybe too many times. Is there a certain age when you can start expecting to see some problems, or you shouldn't be as shocked if you have an issue?
Yeah, that's really it's a difficult question. I think definitely after 50, you start to commonly see some drop off in that area. A lot of guys in their 40s start to have, some issues. There's factors that, if you've had high blood pressure, diabetes, a lot of these other factors, even obesity, over time can affect you, and you can start having symptoms earlier than others would have. So another good point, kind of switching topics about testosterone treatment, you do have to be aware of, especially the younger guys, is just fertility, you know, and it can affect your fertility. Actually getting the treatment can actually decrease your fertility. So we have to look at whether or not you desire to have children or in the future, or if you have what you already or have what you wanted and so forth, when we design what treatment you need if you have low testosterone. So that's just something to think about.
Okay, so again, the topic has been low testosterone today, an issue plaguing numbers-wise. Is this thousands of men that suffer from low T, or is it millions?
Yeah, yeah, it's a large number. It's, I would say, millions.
Wow.
At this point, it's the percentages range when you look at population percentages, but it's a lot higher percentage than you would think.
Hard to believe, and that's why we are here today talking about this issue. And as Dr. Stage was saying, if you haven't been able to pick up the phone, give us a call or send in your questions through our ktbs.com link there. When it comes to your health, you can always swing by and talk to the doc himself. I'm sure you guys, you know, stop by the webpage first. I would probably recommend that before you stop by the office. But you're here to answer questions for anybody out there.
Yeah, definitely. Give us a call. We're really trying to focus on men's health. You probably see us on the billboards a lot of times now, especially on 49, mentioning low testosterone. So it's a big health issue right now, you know, and it affects you in your life in a lot of different ways. So
okay, Doctor, thank you so much for being here with us today. Stay tuned to KTBS for much more health news for you.